Behavior management. Behavior management is not just an individual approach. Rather, it is a comprehensive methodology which is meant to build a relationship between a dental professional as well as the patient. So, what is the main objective behind behavior management? It is to develop interpersonal, intrapersonal, and social factors which influence the behavior of a child in the dental clinic. It also teaches that mind and body are interdependent on each other. The aim of a particular topic is to understand the various factorial elements of behavior management technique and implementing the same in the dental operatory. So, a few definitions of essence are. Now, what is behavior? Behavior, it is any change which is observed in action of an organism. And what is behavior management? According to Wright, which was given in 1975, it is a means by which a dental health team effectively and efficiently performs treatment for a child and at the same time instills a positive dental attitude. Now, what is behavior modification? Behavior modification was defined by Mathewson as an attempt to alter human behavior and emotion in a beneficial manner in accordance to the laws of modern learning theory. So the main aim of behavior management is not only to manage behavior of a child but also to instill a positive dental attitude in that child, to instill the importance of his personal oral care in that child so that the child gets or develops into a proper citizen for tomorrow. So now there are various classifications for the behavior of a child which is observed in a dental clinic. They are as follows: Wilson's classification, Frankel's classification, Lamshay's classification, Wright's classification, and classification of child's behavior in a dental office. So coming over to one of the most primitive and oldest classification, which was given by Dr. Wilson in the year 1933. It is classified into normal or a bold child, tasteful or a timid child, hysterical or a rebellious child, and nervous or a fearful child. Now we'll see in detail what the following terms means. Now, what is a normal or a bold child? A normal or a bold child is one who does not fears of any new situation, one who is brave enough to change, one who is brave enough to face new situations of life. He is friendly, he accepts the dental treatment readily. The child holds a very good rapport with the dentist as well as the dental personnel, and even more, the child is very cheerful and happy to receive the dental treatment. The child understands the importance of proper dental treatment. Now, what is a tasteful and a timid child? Such a child is usually a bit shy of the new circumstances of the dental clinic. This is because of an overprotective mother or overprotective parents. Now, such type of child may accept the dental treatment, but he is not very cheerful. He will show slight negativism towards the treatment. A hysterious or a rebellious child is one who is highly fearful to accept the dental treatment. He is highly rebellious to understand or obey to any commands of the dentist or the parents. Such a child can show temper tantrums in the clinic, like lashing of feet and hand, crying forcefully, then stamping of feet, slamming of the doors, etc. Now, what is a nervous child? A nervous child is anxious and fearful of the new surroundings. He is also tense of the new operatory procedures which he may face and show negativism in behavior. Now, coming over to another classification of the child's behavior that was given by Dr. Wright. He classified children into having a cooperative behavior and the uncooperative behavior. The cooperative behavior was further classified into cooperative, then lacking cooperative ability, then potentially cooperative. And the uncooperative behavior were further classified into a child having uncontrolled behavior, a defiant behavior, a timid behavior, tense cooperative, whining, and stoic type of behavior. Now coming over in detail about the individual categories. Now a cooperative child is one who is totally relaxed. He can accept the dental treatment easily. He is cheerful. He has negligible apprehension towards the new situation. A child who's lacking cooperative ability is generally a mentally or a physically handicapped child, or a child who is too young to understand the importance of oral care or understand the importance of dental procedures or follow the instructions of a dentist, because he is not even understanding what the dentist is saying. So, such a child is said to have lacking cooperative ability. Now, what is a potentially cooperative child? Such a child who can be converted into a cooperative child by the means of proper behavior management techniques. But generally, such a child, due to pre-invested fears either by the family or previous experiences in the dental clinic, may not behave properly at the first appointment. So such a child is called potentially cooperative, that the child can have or he has the potential to cooperate. Now coming over to the uncooperative categories. Now what is an uncontrolled child? Such a child will always show temper tantrums in the clinic. As soon as the child will enter the clinic, he or she will start crying forcefully and show extreme negativism in the behavior. The child can also stamp his feet, lash out his arms or legs, or will not accept the dental treatment at all. He will not open the mouth at all. Now what is a defiant child? Defiant child defies the instructions of the dentist. He will not obey to the dentist at all. He is also a stubborn or a spoiled child due to over-pampering or overprotective nature of the parents. Now coming over to the tense cooperative category. Such a child is tense mentally and is anxious of the new dental situations. But he is a borderline case. He or she is a borderline case, that is, he or she may cooperate to the dental procedures and does not usually resist the dental treatment. Now coming over to the timid or a shy category. Such a child is shy by nature. The child will not hold a very good rapport with the dentist. He will not maintain eye contact with the dentist. So conversations for such child is not possible easily. Now what is a whining child? A whining behavior child is generally continuously complaining about the treatment, that I am having pain, slow crying, tedious nature of a child can be observed. The continuous crying of a child during the operatory procedure will show that the child is a whining child. This is a compensatory mechanism to subside or subdue the sounds which are created by the scaler or the aerator by a child. Now, what is a stoic child? A stoic child is generally a battered child or a child who has any mental or physically abused child. Such a child will submit to the dentist, will accept the dental procedures easily but without any complaint or expression on the face. Now, what are the various behavior rating scales in dentistry? These are as follows: Frankel's behavior rating scale, Hoop's scale, a global rating scale, and the Sanet and co-workers classification. But one of the most popular behavior rating scale which is discussed is Frankel's behavior rating scale, which was given by Dr. Frankel in the year 1962. He further classified the behavior of the child in a dental operatory as definitely negative, negative, then positive and definitely positive. Now let us know what the individual term stands for. A definitely negative child. As soon as the child enters the clinic, the child will start crying forcefully and will not open the mouth at all, will not sit on the dental chair. All these things indicate that a child is definitely negative and not accept any type of dental treatment without any behavior management techniques. Such a child can also be highly stubborn, stoic, or refuse the dental treatment. The child will also show temper tantrums like lashing of arms, feet, stamping of feet, even the throwing things around. Now, a dentist's responsibility is not to accept such type of behavior, but to offer him behavior management techniques. Now, another thing is, what is a negative child? Such a child will show slight negativism in behavior, but finally will accept the dental treatment through behavior management techniques. The child will be reluctant to accept dental treatment. Now, what is a positive child? This is a borderline case in which the child will accept the dental treatment but with slight resistance. He can also be a timid child, a shy child, or a whining child. Now, what is a definitely positive behavior of a child in the clinic? Such a child is very positive for the dental treatment, accepts the dental treatment cheerfully, holds a good rapport with the dentist as well as the dental professional, and the child is highly cooperative to all the dental procedures. He also understands the importance of good oral health. Now, there are various reactions of a child in the dental clinic. It is said that as the first tooth erupts in the oral cavity, the parents should take the child to the dentist for examination. But it should not be later than 3 to 4 years of age. Generally, it is seen that the preschoolers have the best cooperative ability, and highest rate of uncooperative behavior is generally seen if the child is asked to take dental radiographs or while receiving local anesthesia or injections. This may cause discomfort to the patient, so the patients may turn uncooperative. Now, there are certain factors, there are certain things which affect the behavior of a child in the dental clinic. They can be classified as those which are under the control of the dentist, those which are out of control of the dentist, and those which are under control of the parents. The various factors which are under the control of the dentist can be enumerated as the official environment, the dentist activity, the dentist attire, the dentist attitude, the presence of the parents in the dental operatory, the absence of the parents in the dental operatory, as well the presence of siblings or their brothers or sisters in the dental operatory. Now, where there are various factors under which the dentist has any control. These are the growth and the development, nutritional factors, the past dental experience of the child, any negative experience, the school environment, and the socio-economic status of the child. Now, there are certain factors which are under the control of the parents, the mother or the father. These are the maternal behavior, the family, the developmental and the peer influence, as well the home environment. Now, one of the most deciding factor of the behavior of a child in the dental clinic is those factors which are under the control of parents. And the first and the foremost is the maternal influence on the personality of the child. There are various maternal attitudes which affect the behavior of a child, generalized way, or the behavior of a child in the dental clinic. I'll be explaining these factors or the nature further. Now, if the mother is overprotective, let us see how this overprotectivism of the mother has influence on the child. A mother who is overprotective will always shower pampering on the child, will always give the child whatever he wants. The child will not be let to realize any fearful situations. Child will always be kept away from the fearful situations or the new situations of life. But this may be due to if the mother has late pregnancy, or if the mother has an only child, or if the child may be suffering from any mental, physical disorder. Such a mother will always be overprotective for the child. Now let us see what this overprotectivism of the mother has influence on the child. Even the overprotective mother can be a dominant mother or an overindulgent mother. So, in a dominant mother, the child will generally be submissive or shy, and in the overindulgent mother, the child will be anxious, aggressive, and will show excessive type of overactivity and will be demanding too. So, in the overprotective mother, generally the relationship with the child is very closed, both emotionally and physically. Such a child will be polite, will be shy, will also be obedient, but the child always depends on the mother for his or her needs. Such a child generally fears new situations and will not fit easily in the dental operatory. Usually, it's difficult to make contact, it's difficult to make a rapport with that child. But by various behavior management techniques such as tell, show, do, desensitization, and creating a self-confidence in the child will help in managing the child in the dental clinic. Now, moving over to another category is the overindulgent mother. Such a mother will always indulge in various activities and behaviors of the child. The child will show aggressive behavior, demanding. The child will generally be spoiled and stubborn. Generally, in such type of a child will find out his or her own ways, will not generally obey to the command of the dentist, and will be unable to hold a good rapport with the dentist. The child can also show temper tantrums in the clinic. Now, what is an under-affectionate mother? Such a type of mother will not show affection for the child. This is because of the mother will have, due to the mother may be having some problems, emotional problems, psychological problems, or unwanted child, or due to a very ambitious mother who is more involved in her career. So such type of child will be a well-behaved child, one who is shy but will accept the dental treatment easily. Now, a rejecting mother is generally one who does not love her child at all. Maybe by the means of physical or verbal ridicule, the child will be punished. The neglect may show up as physical abuse signs, battered child, and neglected dental or overall health, and such a mother will always refuse to spend time or money on the child. The features of the child are the child may be aggressive, he may have lack of self-esteem, will always try to gain attention, and is one of the most difficult to manage in the clinic. The management of said child can be brought about by developing confidence in the child, immediately meeting all the needs of the child and showing love and affection to the child. Now, what is an authoritarian mother? An authoritarian mother will always show her own set of rules for the child and will expect the child to order or to follow her means. Such a child will generally be shy, submissive, that was all that the child will always submit to the dental treatment, obey to the commands but slowly, can be evasive or dawdling. That is, the child will not develop any type of commitment with the dentist. He will always avoid the dental treatment by delaying it. So, he or she may also waste the time of the dentist and a very slow child. Such a child can also cry easily and lacks confidence during the dental cleaning. Now, what is the effect of the environment of home on the behavior of the child? Generally, broken homes or separated parents may have insecure child who is inferior, apathetic or depressed. Now, what is the influence of the siblings or the peer on the behavior of the child? Generally, if the elder brother or elder sister is present, they may represent as a role model to the child. The child can follow their behavior and activities in the home. This depends on the order of the child or the position of the child in the family. Even the internal family conflicts have effect on the child's behavior. So it is generally seen that younger children follow their elder siblings in the behavior. Now, moving over to the factors which are under the control of the dentist. They can be enumerated as: first and the foremost is the attitude and activity of the dentist, which can be further subclassified as data gathering and observation, underlying which is structuring, externalization, empathy and support, flexible authority, and education and training. Now let us see what is data gathering and observation. Now, as soon as the child and the parents enter the clinic, the dentist should observe the behavior of both. Both formal and informal interview should be carried out. For example, asking about the family background of the child, the name of the child, the standards, the class, friends, hobbies, etc. of the child, as well as their socio-economic status. So, whatever the child's family basically is, the dentist will come to know. This will help him in managing the child in the clinic. Now, what is structuring? Structuring is basically preparing the child for future appointments. The dentist may convey to the child that what does he expects from the child. What type of behavior does the dentist expect from the child? Whatever is required from the child. Dentist can also teach the importance of good oral health at that point of time. Next comes externalization, that is distraction of the child. The child's attention is focused away from the dental operatory or the sensations which he may encounter during the dental treatment. Now, what is empathy and support? Generally, empathy is to keep oneself in the position of others and not losing their own identity. Basically, feeling what the others may feel during a particular point of time without losing own individual ability. So the dentist should be very empathetic to the child. Listen to the child, comfort to the child, and encourage the child to cooperate and accept the dental treatment easily. The dentist should always be a flexible authority, that is, to listen to all the demands of the child and if possible, obey to the demands. The dentist should also educate the parents as well as the child importance of good oral health. Now, there are various factors which are present in the dental clinic which may further affect the behavior of the child. It should always be divided into the reception area and the operatory area. The reception area should be away from the operatory area so that the sounds of the scaler, the aerator and other machines will not induce any fear in the waiting patients. The reception area should be very attractive. It should constitute well maintained, neat chairs, lounges, sofas, even the nursery chair should be there. An attractive aquarium can be put up, proper carpets, curtains, bright and colorful, either of the cartoon characters even can be maintained. Even comics of interest of the child should be put up in the reception area. The proper posters can be put up of happy patients or happy children playing. Now, what should be accordingly the dental operatory? The dental operatory should be neatly maintained with dental chairs, the posters of child being treated or animals being treated around. Now, the dental personnel or the dental auxiliary should also be well behaved and meet the child with greeting and a warm smile. Further, he should also be trained in making toys out of cotton rolls which can be presented to the child further during the visits. Generally, the dentist attire have a negative effect on behavior of the child because a child may have the fear of white coat. But there are no studies so far which are conducted on the same. Now, basically it is said that the children should have early morning appointments so that their nap time is avoided. It is seen deterioration of the behavior of children during long appointments. They should be kept as small as possible, minimum of 30 minutes. Even early morning appointments are given to children. Generally, it is seen that there is no significant difference between children's behavior during long and short appointments. Now, if the absence or the presence of the mother also affects the behavior of the child, generally presence of the mothers will infest a positive attitude or a positive behavior in the child. Generally, if a child is more than 5 to 7 years of age, presence or absence of mother will not have any effect. If the older sibling is present, he may act as a role model for the younger sibling, for him to act and behave properly. 3 years of age have little influence of the presence of sibling in the operatory, while 4 to 5 years of age have noticeable appearance. The skill and the speed of the dentist should be very accurate. The dentist should be highly skilled to perform the treatment, should not be sluggish like finding out of instruments, arranging the instruments, etc. The patient should be preferably the only treatment patient and the following appointment. Even the use of fear-promoting words should be avoided, like injection, syringe, etc. For example, the dentist can use euphemism, that is, substitute words for the treatments. They can be as raincoat, which is used for rubber dam, then tooth bug for caries, whistler for the means of aerator, and other terms also. Now, there are various factors which are out of control of the dentist. These can be growth and development. For example, if the patient is having cleft lip and palate, that will be out of control of the dentist. The nutritional factors, suppose the patient is hypoglycemic or hyperglycemic. It is found that hyperglycemic patients or persons have a higher irritability level than the hypoglycemic patients. And hypoglycemic patients are found of criminal activities. Then the patients who do not have breakfast in the morning may also be irritable or uncooperative behaviored. Now, even the socio-economic status plays an important role in the behavior of the child. Generally, children of lower socio-economic status will not find a good dental health and a good dental attitude, whereas patients with high socio-economic status will be cooperative and understand the importance of good oral health. School environment plays at least 50% role in shaping the behavior of the child. Generally, past medical and dental experience, if they are negative, that will infest a negative attitude in the child. Now coming over to the classifications of various behavior management techniques. Now starting with the classification of various behavior management techniques in the dental operatory. They can be classified as non-pharmacological or psychological means of behavior management, then the pharmacological means of behavior management. The non-pharmacological means can further be subdivided into pre-medications, conscious sedation or the general anesthesia, and the psychological or the non-pharmacological means are classified into communication, behavior shaping and the behavior management. Now, behavior shaping is further classified into desensitization, modeling and contingency management, whereas the disruptive techniques are classified into voice control, aversive conditioning, home and physical restraints, whereas the other means of behavior management are distraction, audio analgesia, biofeedback, hypnosis, humor, coping and relaxation. The American Academy of Pediatric Dentistry in the year 2003 gave a classification which includes communicative behavior management techniques, which are further classified as Teddy-Show-Do, voice control, positive reinforcement, distraction and non-verbal communication. Further, the other categories are conscious sedation, general anesthesia, home, nitrous oxide inhalation and the physical restraints. Now, there are various domains under which the child can be treated. They are physical domain, pharmacological domain, the aversive domain, reward-oriented domain and the linguistic domain. Now, what is this physical domain? In such, the children who are highly uncooperative or showing hysterical or belligerent behavior, such type of children are treated under physical domain. That is, by the means of physical restrictions, their arms and feet and their body is restricted for any unwanted movements, so that the dentist can operate on the child easily and efficiently. Such type of restraints can be body restraints, limbs restraints, restraints of the head, etc. For example, the papoose board. There are also mouth props which can be used at the time of injection in the fatigued child, a stubborn or a non-resilient child, a mentally or a physically handicapped child, or in the case of very young child who is unable to open their mouth for long appointments. Generally, the mouth props can be either of rubberized type or mold's mouth prop with a chain. Now, under the pharmacological domains comes the conscious sedation, nitrous oxide analgesia. Generally, it is the last resort for the treatment of uncooperative children. Appropriate monitoring for such type of treatment should be by the anesthetist. Then the aversive domain constitutes home technique, that is hand over mouth exercise, which will be explained further. Reward oriented domain constitutes the rewarding strategies in order to reinforce a particular better behavior in the child. Then the linguistic domain comprises of generally communication between the child, the dentist and the dental professional as well as the parents. Now basically, Before commencing to any dental treatment or behavior management properties strategies, a pre-appointment behavior modification should be done for the child. This can be done by the means of audio-visual aids, by the means of tapes, by the means of visual films, pre-appointment mailings, or live patient model, such as to prepare the child for the future visits. It can also be made by the means of telephonic conversation with the parent as well as the child. Now commencing over further to the various behavior modification techniques in detail, starting with the one which is foremost and the most important is communication. Now what is communication? It is to establish the relationship with the child, the to and fro exchange of ideas with the child. It is one of the most universally followed technique in the dental clinic. It can be either followed by a normal dental professional or a pedodontist too. This is the elementary technique which can be operated both in a cooperative as well as the uncooperative child. Now what is the main aim for communication? It is to establish relationship with the child and to gain attention of the child. The communication strategies can either be verbal, non-verbal, or both. The verbal constitutes speech of expression, non-verbal institutes body language, smiling, eye contact, the expressions or the feeling without speaking, showing of concern to the child, touching the child, patting the child, and even hugging the child. There may be a mixture of both verbal or non-verbal to shape the behavior of the child in the clinic. So this is one of the most basic technique I've already told. It should be used right from the point when the child enters the dental clinic. What are the key elements for communicative technique? First and the foremost is establishment or starting of the conversation with the child. This should be with total truthfulness so as to maintain and establish trust in the child. The message should be conveyed in total clear language which could be understood by the child. The voice should be firm and authoritarian. A multisensory communication by the means of verbal or non-verbal means can be done, like expression of a smile, even a pat on the back of the child, holding hands of the child and taking the child to the dental chair. The environment for communication should be a relaxed environment which is peaceful so that the communicative words could easily reach and understood by the child. Here, the dentist can act as a transmitter. The child will act as a receiver and the words are the medium. The dentist should always follow problem ownership. That is, the dentist should not use fear-provoking terms such as injection, anesthesia, or you should sit here, should not give direct commands to the child. The dentist should rather say, can you help me in order to fix your teeth? Please smile so that I can make your smile better. Even active listening by the dentist should be there. The dentist should actively listen to all the instructions or all the points that the child tells actively. The child should realize that the dentist is sympathetic towards the child. Even appropriate response by the dentist should be given to the child, and a confident communication should be developed. The dentist should not be slurpy or weak in communication. Now there are certain words which can be used as substitute words for the instruments in used dental operatory. They can be like rubber dam is substituted by a raincoat. The rubber dam clamp by the tooth button, the frame by the rack, the sealant by the tooth paint. The topical fluoride gel can be considered as a cavity fighter. Even the alginate impressions which are taken can be referred as pudding or chewing gum to the child because of their minty taste and refreshing flavor. The high speeds handpiece can be referred as whistler, and the low speed ones or the micromotor can be referred as the motorcycle. Another means of this behavior management technique which underlies behavior shaping is desensitization. Now let us know what is desensitization. Desensitization, it was proposed by Dr. Wolf. He told that it is the gradual exposure of the stimuli from less to more fearful in order to banish any pre-established fear from the child from the previous dental experience. That is, it is a hierarchy of stimulus which are exposed to the child from less fearful to more fearful. Generally, it works under the principle of reciprocal inhibition. That is, the appropriate emotional response can be instituted by an inappropriate stimulus. For example, first, the child can be exposed to oral prophylaxis or scaling. Next, slowly, the hand instruments such as a scaler, the sharper, probe or the explorer can be shown to the child. Later on, rubber dam, dental drill can be used on the child, and finally the injection can be given. So this is the successful approximation of the hierarchy of fearful stimulus to the child in order to obtain a proper acceptable behavior from the child. So the main disadvantage of this technique is that this is one of the slowest method and requires a number of appointments for the child to come for the treatment. So desensitization is basically a process that develops the desired behavior by successful approximation of the desired behavior till the one behavior that is expected that comes into being. One of the most important methods which underlies desensitization is the tell, show, do technique, which was given by Dr. Adelson in the year 1959. It says tell, show, do. First, the dentist should tell the patient, then show or demonstrate the patient, then do whatever as he is told previously. The main objectives of this procedure is to teach the patient the importance of good oral health, then familiarize the patient with the dental surroundings and the dental instruments, and to shape behavior of the child. Now, the dentist should always approach the child with pure honesty. Whatever he has explained to the child should be followed by the dentist completely. The dentist should not tell any lie to the child or should not deviate from whatever he has already told. Otherwise, this will lead into breaking of the trust of the child. Later, after telling, the dentist should show the instruments in a hierarchical way. Like first the dentist should show probe, the mouth mirror, and later on the explorer, the scaling instruments and the drilling instrument. The dentist should entirely demonstrate the procedure on the model to the child and finally do the same as which is told to the child. Now, what are the indications of such type of process? The indications are all the patients who can communicate to the dentist or who can understand the words of the dentist and follow the instructions of the dentist can be encountered with such a procedure. The dentist should tell the patient the entire procedure in a brief and the explanatory way, so that with the grades of fear-promoting stimuli. Generally, it is indicated in the first dental visit or the subsequent visits and the patient who is apprehensive or who is referred. There are certain modifications for the technique. These modifications are tell, touch, do, then tell, touch, smell, tell, show, do, and show, touch, smell. Now, further going over back to the other behavior management techniques. Moving over to the behavior shaping techniques, that is the modeling. Now, modeling is generally based on social learning theory. It was given by Dr. Albert Bandura. In modeling, the patient is allowed to view one or more individuals or a patient who is present in the dental operatory and expected to follow the same as which is depicted by the model in the future visits. Generally, the models are live models, the film models, the models with posters or the audio visual aids. Live models are those which are being operated in the dental operatory. They can also be the siblings of children. Generally, the child relates to the siblings very easily. So, the behavior which is followed by the siblings can be followed in future visits by the child dental patient itself. Generally, the children who are elder than 4 years or 5 years of age have no effect of the elder siblings in the operatory. Then film models, that is video films of the models, can be depicted to the child. The posters in which the child are being treated and happy can be shown to the child so that they can act as a model of learning to the child. Even the audio visuals can be presented to the child for further learning. The main indications of the model are the first dental visits, the subsequent visits, or the referred child who may be anxious or fearful to accept the new dental treatment. The advantage of the same are no extra time or effort is needed in modeling. Simultaneously, during which a model is depicted, the procedure can be followed on the same child. No extra armamentarium is required for the procedure. Now, what is contingency management? It is the method of modifying behavior of the child in the dental clinic by either contingence, presence, or withdrawal of a particular stimulus from the clinic. This can be further divided into positive reinforcement and negative reinforcement. Positive reinforcement is that stimulus which presence may reinforce the particular behavior in the child, the contingent presence of which may enhance positive behavior in the child. For example, if the child displays a good behavior or cooperates during a dental treatment, then the child can be presented with a reward such as a toy or puzzle, etc. Now, what is negative reinforcement? If the child misbehaves in the dental clinic, particular punishments can be given to the child, or withdrawal of a particular positive stimulus can be done for the child. For example, withdrawal of the mother from the operatory. Even if the child shows a bad behavior, a stubborn behavior in the dental clinic and does not follow the instruction of the parents or the dentist, then if the child delays the dental treatment and the child is given next appointment, this type of behavior will be reinforced in the child, and this will be a negative reinforcement or negative contingency management. There are various types of these reinforcers. They can be social, for example, the presence of the mother in the operatory, the pat, the smile, or the praise to the child. For example, that the child is wearing very nice dress, the child is looking beautiful, the expressions of content to the child, that the appreciations which are given to the child can act as positive reinforcement or social reinforcement to the child. Then material reinforcers can be like a toy, a book, a puzzle, a small gift from the dentist to the girls like clips, bangles, etc. can act as material reinforcers. Then activity reinforcers can be either a cartoon show, a TV show, a cassette which will be given to the child for further activity. Now, it is said that 1 out of 4 children in the dental clinic will be difficult to manage. The relationship between the child and the dentist needs dialogue, tone, and expression. The aim of proper behavior management techniques include good health of the child, positive attitude of the child towards dentistry, and to build the trust and allay any fear or anxiety from mind of the child. The various other behavior management techniques can be classified as distraction, audio distraction or audio analgesia, then video distraction, the biofeedback, hypnosis, coping, humor, relaxation, and implosion therapy. Now let us see what is audio distraction. It is also referred as the white noise. It works by the principle of distraction, that is externalization of a child from a particular stimulus or a particular environment to another environment, focusing the attention of the child away from a fearful stimulus. The music will be played to the child, so the child will be unable to attend to any fearful dental stimulus. It can be of high amplitude also. This will lead to allay the anxiety and fear of the child. There are a number of studies which have been done on this technique recently. Now basically what happens, that music is used for the distraction purpose, but other films, cartoon sounds, and even loud music, songs can be used for such type of treatment. Even instrumental music is also used. This allays the pain, anxiety, and stress of the child. Now what is biofeedback? Biofeedback is basically monitoring the vitals of the child or vitals of the patient like blood pressure, the pulse rate, etc. And if the BP or the pulse rate or other vitals are increased, then the subject is taught how to control them and to control the signals. These are generally responses in order for high dental fear, and they need to be allayed or decreased. This is biofeedback. Now, another technique of behavior management is humor, which is employed by the dentist to decrease the fearful stimulus for both the parents and the children. They can be either of social type to maintain a social relationship with the children and the parents. They can be also of emotional type, like to relieve anxiety of the child and allay the fears. They also help in motivate the child and help in developing a cognitive behavior, and information is often conveyed to the child by the means of humor. Now what is coping? Coping is the cognitive and the behavioral efforts which are made by the child or the dentist or the individual to relieve any stress or any fears from the dental operatory. It can be either of physical type by the means of signal system, that is dentist asks the child to raise their hands whenever they experience any fear, tension or any hurt or pain. This will allay, decrease the tension, the fear, the pain and increase the friendliness between the dentist and the patient. Another method is by drawing to the comfort zone. This may be encountered by the child personally. The child may say to himself or herself that everything is okay around, all is well. This calms and reassures the child. This also helps the child to perceive the situation in a non-threatening way. Then comes the hypnosis. It is also categorized as hypnodontics. That is, the decreased fear in the child can be allayed by the means of hypnosis. This is the heightened susceptibility of the child to pursue the desired behavior. So, another technique is the relaxation technique, by which various exercises are taught to the child for help in allaying the fear of the child and experiencing the dental treatment in more relaxed pattern. They can be either 10 to 20 times a day, or breathing exercises can also help to decrease fear in the child. Then comes finally the relaxation implosion therapy. Implosion is the flooding of fearful stimuli to the child so that the child has no other option but to face the stimuli. For example, various implosion therapies used are home, voice control, and physical restraints. Now, let us come up to the various disruptive behavior management techniques which can be used in a highly uncooperative child. First and the foremost is the voice control. Voice control type of behavior management techniques is generally employed in highly uncooperative child. Here, the main aim of this technique is to dominate any interaction between the dentist and the child and to convey all the instructions to the child in the affirmative and the authoritarian way. The voice of the dentist should be firm but soft on the same side. This can be used in conjunction with home or physical restraint techniques too. But informed consent before this voice control technique should be taken from the parents. This also conveys to the child that dentist is an authority to be obeyed. And in order to seek attention of a defiant or deviant child, voice control can be practiced. In fact, this is one of the most important and frequently used strategies in management of uncooperative children. Now, what is aversion? Aversion is the use of aversive techniques for children. The basic aversive technique is home. Home was introduced by Dr. Evangeline Jordan in the year 1920. The purpose of this technique is to gain attention of the child. The full form of this is hand over mouth exercise. The main indications of this technique are a defiant child, a highly uncooperative child, a child who is less than 3 years of age will not be followed the home technique, then a child who is uncontrollable and can understand the verbal instructions of the dentist. Generally, home is not indicated in handicapped children who are mentally or physically handicapped or very young children. Informed consent should be taken from the parents before practicing this technique. The technique employs gaining attention of the child. What will the dentist do in this technique? The dentist will slowly bring or places his hand over the mouth of the child in order to stop the child from crying fearfully or forcefully, and the expectations of the dentist for the child are told in the ear of the child slowly and firmly. Then further, if the child shows the willingness to cooperate with the dentist, the hand is taken off from the child's mouth. This can be operated within 20 to 30 seconds. Even another technique is hand over nose and mouth with airway restricted. That is, in this technique, the dentist can pinch the nose of the child for 10 to 15 seconds. Thus, the child will start cooperating so as to breathe from the nose. But this should not be practiced for more than 15 seconds. And informed consent is mandatory for such a technique. Next comes the physical restraint behavior management technique. In this, the body The extremities, the head or the hands are kept away from moving by the means of any physical restrictions. For example, for the body, the restrictions used are the bean bag, the papoose board, the sheath, the towel or the tape. In order to maintain the extremities, various posy straps, velcro straps, towel or tape can be used. The positioning of the head can be kept stable by the means of forearm body support and by the means of head positioner. So, generally, a highly uncooperative child will need these techniques and an informed consent is mandatory from the parents. So, these aversive means like physical restraints, home can only be used by the means of informed consent and they are hardly used by the dentist. There are certain techniques like tell, show, do, the contingency management which are frequently used by all over the dentist in the world. Even communication is one of the best techniques, which is the most elementary techniques which is widely followed or universally acceptable by both the parents as well as the dentist. General anesthesia and conscious sedation are followed by periodontists in the case of highly uncooperative patients or patients who are definitely negative. So, the management of a child in a dental clinic is generally like a magic. It employs the knowledge, behavior, the common sense and experience of a dentist for the proper management of a child in a dental clinic.